topic for today's sessions. Reconstruction surgery can be transformative, aiming for limb preservations, enhanced function, and improved mobility. The Ilizarov method, which utilizes destruction osteogenesis, is a prominent technique in bone reconstruction. This tissue sparing approach fosters significant regenerative effects and stimulates bone growth. It is particularly effective for treating infections, bony and soft tissue defects, and complex cases involving multiple comorbidities. So, further discussion would be held by doctor himself. So, without further ado, I would like to hand over this session to you, sir. Kindly proceed with your talk.
Very good evening, Melinda, and thanks for inviting me in such a eminent platform. So, am I audible? So, can you please hear my voice?
Put them on full screen mode, sir.
Yeah. My screen is visible?
Absolutely, sir.
Yeah. So, good evening, everybody. I am Dr. Shamsul Hoda from Patna, Bihar. And I'm really thanks to Melissa for giving us such a detailed and descriptive introduction about me. Let me introduce what is Ilizarov. Ilizarov is a ring device, as you can see in the picture. So whenever we get such a bad injuries, bad RTS, and when there is no hope for limb salvage, we just apply X6 and wait for some time so that limb can be salvaged, and we see that there is a long bone gap. And after maybe 2 or 3 months, we get that this pass, we cannot save the limb, and we ask someone to, we can just have to go for amputation, we cannot save the limb. But we have got a sound knowledge of Ilizarov, and you can see that distal limb is viable. The limb can be salvaged. Here's my topic goes on that the Ilizarov method in limb salvage is reconstruction surgery. So let me also tell you what is Assam India. Assam India is the National Association of Ilizarov Surgeons of India, and I'm the National Secretary of Assam India. Besides, I'm IT coordinator of Indian Orthopedic Association and IOTV, Ortho TV. I run 2 hospitals in Ortho World and West Hospital at Patna and Hajipur. And I've been international faculty at USA, Baltimore, Gurgaon, Russia, Dhaka, Bangladesh, Cairo, and other countries. So let's start with my topic. So in a regular bad post-traumatic complex injuries, it's very difficult to decide whether we have to amputate or you can salvage. You can see the bad injuries. So if the distal part is viable, you can see in the video, it's a very crushed bad injury. But if the distal pulse is viable, you can see the distal pulse here. Then you can try for Ilizarov, you can save the limb if you have a good training. So if you have a Ilizarov instrumentation in your hand, and you have a Ilizarov sprained brain, then you can do limb salvage in all these bad cases. You can see in the pictures. So when you get any complex orthopedic trauma, we have to first check the associated problems like the patient is in shock, there is a head injury, there is a visceral or maxillofacial injury, and we have to see that you need a care of ICU, multidisciplinary support, hemostasis, similar. So if the patient is viable, living, and stable, so then we can go for limb salvage. And when you go to the limb, we have to see that there is a combination, this compartment syndrome, neurovascular injury, bone and soft tissue loss, degloving, infection, or amputation risk. So before you go to save the limb, you have to go for the diagnostic protocol like X-rays. We go for grading of the fracture, plan of treatment, evaluation of healing. Then we go for 3D or 3D CT or CT to see for the head injury, visceral injury, maxillofacial combination and grading. That helps in the 3D CT, as you can see the different cities. And you have to see for the CT angio for any vascular injury. We have done a surgery and finally we get that we cannot salvage the limb. So this is a very important part. Then with MRI, we see the soft tissue, joint cartilage, nerve and spine. There is no palsy in the limb. We're not leaving a fractured limb. And for the VSG, you have to see the visceral injury. There is no splenic injury. There is no pelvic injury. So when all these things are good and the patient is stable, then we can think of the limb salvage. And then we classify this is a regular classification to see and all that compound fracture, the dustular annual classification in regular type 1, type 2. You can go for the ideal nailing of plating. Type 2, we can go for skin graft. Ilizarov is an option. Type 3, there is open fracture, soft tissue muscle injury. When you see that X6 can be applied, Ilizarov is a better option. In type 3B, there is extensive soft tissue loss. facial stripping, bone exposed, bone loss, and contamination. Ilizarov is a true indication. We can remove the loose bones and do bone transport if needed. In type 3C, there's the arterial injury, we have to do arterial repair, nerve repair, and if still the limb survives, the Ilizarov becomes definitive treatment here. So the advantages of Ilizarov, it is a circumferential support, just like in a typical external setup, there is a unilateral support, and just for the temporary fixation, so it's called a non-union machine. So we can apply the extracts for a temporary period. Here it gives us circumferential support, so it adds on to the union of the bone also. It gives a very good union, and patient can do next post of the fluid bearing. Fluid bearing all the patients after putting Ilizarov can do full load bearing. So there's no bed rest after Ilizarov. Patient has come to me after 6 months, 1 year on the bed because of X-fix and pus. And after Ilizarov, I make all the patients. We make all the patients, all the Ilizarov surgeons walk next full load bearing. So the patient feels good. They go walk climb stairs. So we can do soft tissue procedures like graft, flap, or whack possible. Just like in X-fix, there is no joint stiffness in the Ilizarov. Use of universal joints, hinges. We can fix the intra-articular fixation well with multi-directional only wires. Just like plate or X-fix gives a unidirectional, Ilizarov gives a multi-directional support. It is a modular implant. All the displacement, angulation, compression, extension can be corrected gradually with Ilizarov. And if there is bone loss, we can do bone transport, limb lengthening, and patient can be trained well for dressing. The disadvantages are that it is a cumbersome implant. It's a heavy implant around the ring. Patient has difficulty in walking, sitting, going school and washrooms. So compliance is very bad at time, and patient has to keep for a long period, like starting from 3 months to 2 years. So compliance is very important. It's cumbersome. Wires have not treated properly. It pains. It can cause infection. The long duration is very, very long. Print augmentation is a common problem. You have to take care of the Ilizarov like a baby. And skin wound dressing is very difficult for the patient, but the patient can be trained well. So I advise all the young surgeons to get a good training of Ilizarov and keep this armamentarium of Ilizarov instrumentation box of these rings and rods and wires in the OT so that they can become a savior. If not, they can send to another Ilizarov surgeon so that the limbs can be saved. The patient's limb is very, very important. So before applying Ilizarov, we just need to have a basic sound knowledge of the safe zones. Just like X-fix is a monolateral and Ilizarov is a circumferential fixation, you have to see which all ways all the wires can be given, where not to go. So safe zones are very, very important in all the parts, the upper limb and the lower limb. So this is a gross idea of diagrammatically, this is a modified diagram that I made to see where the wires or the pins can be gone or not. So the red is the danger zone, green is the safe zone, yellow is the moderate zone. So this is a different diagrammatic orientation. You must need to have a very good knowledge of the safe zones so that you can do a very safe surgeries. These are the basic configurations of Ilizarov that we can do in all the the limbs parts. Starting with the shoulder and elbow configuration, you can fix the shoulder, arm, elbow with various configurations. You can see the olecranon, the distal humerus. It can all be very well fixed if there is comminuted, if there is compounding. You cannot apply a plate or a nail. Ilizarov becomes a wound here. Similarly, we apply in the forearm. If you have a very good knowledge of anatomy, you can apply very well even in the hands. Similarly, we have these are the configurations for the femur, the thigh bone, starting from the hip to proximal femur to distal femur and the knee joint. You can see that you can just transfix knee joint and give a spanning in the X-fix so that the patient can have a joint movements. And similarly, the tibia, the whole of tibia or the distal tibia, the pilon fractures, the shulcus fractures, and then even in the foot or ankle. Foot and ankle surgery indications are very well for the different compounding fracture, for the clubfoot deformities, for limb lengthening. So this also becomes a boon for the foot and ankle surgeons. So these are the various configuration every young surgeon must learn so that you can handle well all the part from upper limb to lower limb in any cases. Let me introduce a few basic fracture reduction techniques so that you don't need to open the fracture. You can see a distal humerus fracture in an adult. Normally, we apply uni or bilateral plates. You have to give a big incisions. But if there is combination, or you cannot just do a joystick with the rings and the wires so that you can easily reduce. You can see the CM picture. It can be easily reduced without opening in almost 80 to 90% of the cases. Only when there is no rotation, you can reduce very well. And then you can apply Ilizarov all over. These are the different techniques for angulation and distraction correction. These are the Oliver techniques for reduction of the fracture. These are the drawbar technique. We need to open the fracture in any of the cases. This is the joystick technique, and this is the archway technique. These are the various animations you can use in early cases. Post-op care is again very, very important in all the cases. We have to, because patient has to wear the ring for a longer time. So if you have good knowledge, you've got a good knowledge of the post-op care, the patient is trained well. You can have an amputation-ready patient to a patient doing his running his own milk shop. You see, it's almost impossible to save the limb. With Ilizarov, we have done it. So this is a patient from Rajasthan, long back way. So you can do very well all the cases. So post-op care is again very, very important. Patient has to be promoted to do activities of daily life. So that patient can do a blooming because patient has to keep all the ring for 1 year. Patient can raise the child, walk on the road, climb the stairs, and do all the activities of daily life, just take the process and all. So physiotherapy has a very important role in all the cases. Exercise, mobilization, ambulation, for almost 2 hours per day has to be trained very well in all the cases. Educate patient, entertain it also. So these are the different physiotherapy, the exercises. The patient has to be trained for the tibia, all the prone, straight leg raising, soft hearts, heel raise. All the exercises are very important. You can take a picture of this. This is for the hip and thigh. And these are certain videos of the same. Patient has to be guided well for all these cases so that the patient do all the exercises. There's no swelling. Patient retains the power. There's no neurological injury. There's no neuropathy. There's no clubfoot. So there's no equinus. So the range of motion has to be full. In next way, though, range of motion is very, very important. All the cases in H6 you don't get the range of motion, but here you can see patient can do all the regular range of motion in all the cases. So you can see patient can do all the hand movements, sit and stop, this squat on the ground. Weight bearing is again very, very important. Patient can do such a bad injuries. Patient can do weight bearing next day. You can see it's a bad ankle wound, almost impossible to save. Patient can walk on the ground and do all the cases. In all the cases, this is a distal tibia column fracture. This is a calcaneum fracture. This is a closed wound. So this is numerous capabilities in all the cases. Similarly, activities of daily life can be done. Patient can do all the activities of daily life, climb stairs. Patient can even drive a bike. I can see here. The patient is driving back with the Ilizarov on his wheels. It's a case of non-union case. So if the patient is trained well, counseling is done well, patient can do all the cases, all the thing of daily life, so that the time, even if it's 1 year or 2 years, can be easily passed. So when the times comes of frame removal and post-patient removal, we have to see for the regenerate, the docking side, the animation is very important. Access for at least 3 causes, particles has to be ossified. We have to check a stress test before we remove the ring. So the animation is very important. That should access the bone has been united well, or we can have another refracture. So protected weight bearing is very important. You can apply braces or casts, avoid strenuous activity. And if there is refracture or a risk, you can apply a brace or a nail or a plate if needed in these cases. Again, the follow is very important. Rehab, range of motion, weight bearing. It's important. Brace if the shaft is involved. Exercise has to be very important in other cases. Let's see a few cases, just examples. So this is a bad distal humerus fracture, open compound. You can see the humerus exposed. You cannot apply a plate in this case. Patient will get infected. If you apply a X-fix, the patient will go in complete stiffness of the elbow. So what comes next? So here comes the role of Ilizarov in these cases. You can do a bit follow debridement on these cases and put multiple olivars. You can see multiple olivars are there. In a plate, you can apply compression on one side. You can see in these cases, you can do compression from all the sides, anterior, posterior, middle, lateral. So you get a very good reduction in these cases. And over that, we apply a ring as needed. So that patient there's a very good reduction and do all the range of motion. You can see it's such a wonderful, beautiful union, almost near normal and around 3.5 months. And see, you cannot delineate which limb was affected. So if you're done well, you can get a very good results in all the cases. There is no stiffness and union is very good. Similar case of distal humerus, again fixed with Ilizarov. This graph was done. Again, case of forearm, because of bad crush, forearm injury with the compartment, Ilizarov was applied. The skin graft was very possible over Ilizarov, and the limb was safe. Patient can do all the exercises, everything, with a very good healing in all the cases. Similar cases of distal humerus, infected cases, patient can do all the activities of daily life, feel very well. Because the ring has been removed here, and the K-wire has been also removed. Let's come to the lower limb parts. You can see it's a bad or typical injury of the lower proximal tibia. Regular surgeon or an intern just puts on the X-fix and just puts like this. Patient comes to us around 4 to 6 months for amputation. You can see the knee is stiff, the foot has gone into equinus, and it's very difficult to salvage. But again, if you are well trained with Ilizarov, you can just remove all these loose bones, put on Ilizarov, do gradual bone transport, and there's no skin grafting needed in all the bone transport cases. There's no use of plastic surgery in these cases. The skin heals very well. And you can see the bone transport has been done. Bone has been united very well. The slab is implanted for some days. Now the patient is driving by. So with this sound knowledge of Ilizarov, you can do very good transport. You can save these limbs with no stiffness. Similar case of distal femur, infected, was removed and Ilizarov was applied, and patient walked next day. This patient was also on bed around 6 months. Similar case of distal tibia, a mild fracture treated with Ilizarov, and tens was applied from inside. So I many times do transport over tens on Ilizarov, so its alignment is good. So this is another case of sciatical fracture. We can see a bad comminuted fracture. Compartment because of spectrum was done. We can apply a plate. It healed very well with Ilizarov with multiple olive wires. Very good direction. Similar case of distal tibia, column fracture. It is coming from upper limb to lower limb. Meaning very well. This is another very interesting case of a young girl of 17 years. She had an RTA with a tractor run over her pelvis. You can see a very bad crush. This including her thighs and genital, everything. Patient was in depression, almost suicidal. We just gave her a hope that we'll try to save your limb and do well with you. Patient has a near knee amputation, and she was advised amputation from hip. She was going to suicide. We tried. We did skin grafting, and the patient was saved. We applied Ilizarov on this case. There was an infection. We did gradual transport, and this very good union was seen. And the patient was so lucky to get married with Ilizarov on her. So very lucky patient. She's a very smiling, beautiful girl. So we could save her thighs with this Ilizarov. Another case of exposed bone with knee flexion contracture, long gap, bone transport was done. Limb was saved very well in this case. Even the knee contracture was corrected. Another case of nailing, common case of bone exposed. Somebody did a nailing, got infected, bone was exposed, removed the nail, applied Ilizarov with bone transport. This is another very good case, interesting case from from Rajasthan, near Pakistan border. Patient was in bed for around 1 year. He was an X-fix with this loose bone, free bone, and patient was raised amputation. Came to me, apart from Rajasthan. We just removed this free bone with around 7 inches, around 18-19 centimeters of bone transport. You can see the gradual transport was done. There is no skin grafted needed in these cases. There was soft tissue impingement. We just did a soft, small surgery to get the parts opposed. And did bone transport was done. Gradually healed. It took around 2 years. Patient was doing all the work. So you can see it's very, very compliant patient. He was very energetic, very positive patient. He was doing everything. And he finally came back. We removed the ring. Patient can walk, do all the things, and he's running his own shop. So this is the patient we need to do motivation and training the patient, very, very important in all these cases. So the hashtag go like Ilizarov saving limbs and hope is life. The hope is life. You have a good trained mind. You can do all these possibilities with Ilizarov. So Ilizarov means possibilities. Similar case of tibia, the bone transport was done very well with Ilizarov. You can see the bone transport was done. These are all impossible cases treated with Ilizarov. Limb salvage is a possibility. Another very bad case. It was ready for amputation. We just said we'll just give a try. There was no promise, but we could finally save the limb. And patient walked next day, and finally was removed. So all these possibilities are there with Ilizarov on. Soft tissue coverage is not a problem. Sometimes there is a bad trauma. You don't need transport. You can just do flap over Ilizarov. You can put Ilizarov on and then see the limb is viable. You can apply a flap. While you are applying flap, you just remove the wires, put a flap, again put the wires on. So flap is a possibility in all these cases. Then skin grafting is a very good possibility in all the cases. Upper limb, lower limb, thigh. See the skin grafting is also known in these cases. Even in the few cases, when you cannot do the transport, you can apply even a VAC therapy, rectum therapy in all these cases to treat very well for policeman. So these are few post-op results of the upper limb. Patient can do all the activities of daily life. Ilizarov doesn't mean it's a difficult device. You cannot do anything. You can do anything with Ilizarov. You can drive a bike. You can raise your child. You cannot do. You can do the fruit vegetable cutting with you. The horns on. Similar cases in the lower limb. After limb lengthening, patient can do gym. This patient's limb of lengthening was done with the Polio cases. Patient do all the gym, everything. So our possibility is limitless in Ilizarov and other cases. So there are a few other indications beside limb salvage for limb reconstruction. You can see clubfoot is a very common indication in all the cases. Clubfoot, I've been treating from birth to around 50 years. On the birth, we apply plasters around 1 year. We can do soft tissue, T lengthening around 5 years. You can apply this, and above 5 years, you apply Ilizarov. So from 5 years to 50 years, you can correct all the cases of difficult clubfoot deformities or club hand deformities. With Ilizarov, you can see the pre-op and post-op complete correction of this clubfoot. You can see the pre-op result here and the post-op results of the doctor who got all the children married and came to me, finally corrected. He's driving bike and everything and doing his practice. So clubfoot, any deformity of the TBR, femur or pediatric deformities can be corrected well with Ilizarov. On the case of clubfoot, I'm not showing all the deformity, it will take very long. So I'm just showing a few cases. Another girl, so such a girl with a magical smile, she had clubfoot, had completely corrected. She has been always smiling in all the treatment period. The treatment period in clubfoot in adult is around 3 to 4 months. So the girl finally got married. I got so many patients with the patient having a clubfoot and she gets married after the correction. So other indications are deformity with limb lengthening. These are the post-traumatic deformity, where then deformity correction and limb lengthening. These are the different indications of clubfoot. Another girl with around, she was not walking for around 7 years. She had a very post-traumatic deformity, limb shortening around more than 17 inches. Her limb lengthening has been done with Ilizarov over TENS. Finally, the correction has been done and she is ready to get, the file picture is not here. She is ready to get the limb removed. So limb lengthening is a very good indication in all the cases. In chondroplasia, we can do limb lengthening in all the cases. So in this case of polio, these are numerous cases of polio. We get a limb shortening, a thin limb, but there is a power. If there is a power and patient has a limb, the limb can be corrected with lengthening with Ilizarov. Now we are doing hybrid cases, lengthening over nails, so that the period of 1 year comes short to around 3 to 4 months only. You can see limb lengthening was done with here. Patient ring has been removed. Patient can do all the exercises to the gym. Patient is ready to get married. So there is no deformity. You can see the patient. So all these possibilities are there with the Ilizarov. Pre-op and post-op picture can be seen. Patient can do all the exercises. So limb lengthening in polio cases is very good possibility with Ilizarov. Yeah. So I advise everybody to keep this Ilizarov armamentarium in your OT so that you can do numerous possibilities with Ilizarov, get a good fellowship. We welcome you all to the Assam India with number of Assam India. So the take-home message here, Ilizarov and compound trauma for limb salvage and reconstruction is an excellent device. With proper application and follow-up is done, it is a wonderful primary fixation device. Good knowledge and experience of Ilizarov is needed. It's a modular implant and can be adjusted post-op as required. Soft tissue heal well with Ilizarov on. Soft tissue flap, dark, whack is friendly with Ilizarov. Joint is not a problem. All the activities of daily life can be done early, so the age is not a problem. You can do from young child to the old age. Patient can do all the activities, can ride a bike, walk on the streets. So again, the hashtag goes like Ilizarov saving limbs. Hope is life. This is my small smiling Ilizarov family that have been treated with me from all the states, starting from Rajasthan to Bangladesh to Assam to all the different cities from Nepal. So you can contact you can just scan and connect with me on the social media on my WhatsApp. I thank everybody. I request everybody to become a member of Assam India. Contact me for anything. Thank you. Thanks a lot.
Well, thank you so much, sir, for your wonderful input and presentation. It was very much lucid and informative as well.